Thanks so much for joining us today.
You're welcome. It's a pleasure to be here.
These injectables, doctor, have become all of the rage among people who are looking to shed a few pounds. But these drugs, are they for everyone?
Well, there are definitely absolute contraindications to taking these medications, and in my mind, several relative contraindications. The absolute contraindications are a patient or a family member has multiple endocrine neoplasia type 2 syndrome, or has a history of medullary carcinoma of the thyroid. And another contraindication is delayed gastric emptying, which is gastroparesis. And that the medicine works in a way to delay gastric emptying, so it'll just make their symptoms very much worse. So you would not want to put people on those medications.
Who would you say is the
Relative
best candidate then to take Ozempic or Wegovy or those types of medications?
Well, these medications are very good. They work very well with patients. They do have several, anyone who is overweight, there's a protocol that we use medications, whether they're injectables or oral medications, stimulant medications or non-stimulant weight loss medications. They have to have risk factors for other disease like high blood pressure, heart disease, depending on what medication you want to take, a chronic obstructive pulmonary disease, obstructive sleep apnea. And if it's all based on your BMI, your body mass index. If your BMI is 27 or higher, you have to have some comorbidities. If your BMI is 30, which is anything over 30 is considered obese, and there are different stages of obesity, then you don't have to have those comorbidities. So there are a lot of people who meet that criteria and will benefit from these medications.
Is there an age limit for taking these particular types of injectables?
I do not think there's an age limit for these medications. We'll treat anyone who meets the criteria of their body mass index with or without comorbidities.
What about risk associated when a person stops taking the drugs, or can you stop once you've reached your goal weight?
Yes, you can stop these medications. These are not addictive. You don't develop a dependence, but there is a problem. And the problem is you're going to gain your weight back most likely. These medications work very well. And if you stop the medication and then don't follow a proper diet, and you don't exercise, you're going to always gain your weight back. But that's true of any diet. You could do your own diet. You can take any other medication. You stop the medications, if you're not exercising, you're going to gain your weight back. When you lose weight, your energy expenditure decreases. You lose weight, it doesn't take as much effort or energy to move around anymore. So anyone who goes on a diet ends up lowering their energy expenditure. And if you stop the medication that help control your hunger, you're going to gain your weight back unless you burn more calories. And you always have to eat a normal diet, an appropriate diet. You have to have whatever diet plan you choose is going to be okay, but you cannot overindulge. And that's where most people fail. That's why people yo-yo all the time, because they stop their diet and they don't exercise and they go back to eating the same way they ate before they did their diet. If you don't change your lifestyle, you're going to always gain your weight back.
Dr. Ravens, Director of Medical Weight Loss Clinic out of Southfield, thank you so much for joining us today and sharing this information with our audience. We appreciate it.
You're welcome. Thank you very much.